More tragedy this afternoon following the Parkland school shooting. Two survivors of that mass shooting at Marjory Stoneman Douglas High School in Florida have now taken their own lives. Last week, 19-year-old Sydney Aiello committed suicide after a battle with survivor's guilt, according to her mother. Aiello was close friends with Meadow Pollock, who was one of the 17 people that was killed. Now, on Saturday, a sophomore at the school also committed suicide. Ryan Perry, who lost his daughter in the shooting, is leading a mental health awareness campaign.
Our message is to encourage parents to sit down with their kids and ask them those questions and understand whether or not they're at risk, because what we learned, unfortunately, this week is that kids that may appear to be okay and not have any issues are actually suffering in silence.
School officials and mental health professionals held an emergency meeting yesterday to discuss ways to engage students left with lingering trauma. And we want to talk more now about this very sensitive topic with clinical psychologist Christina Inglesia. Thank you so much for being here. Christina, these deaths are really spotlighting what is called survivor's guilt. Talk with us a little bit about what that is and how to help those who might be suffering from it.
So by definition, survivor's guilt is the mental and emotional experience that one suffers from after they have survived a traumatic incident where others have died. This can show up immediately after the trauma, months after, or years after, but it is defined as this persistent feeling that somehow, some way, this individual could have done something differently to avoid this occurring or the trauma having this level of severity.
So if you're a parent, aside from talking with your kids, which seems to be the most important thing, what do you do if you suspect that your child or a loved one or a coworker might be suffering from this survivor's guilt?
I agree that the first step is always to have this conversation. But if you begin to notice trends in hopelessness, depression, anxiety, recklessness, impulsivity, then I would beg to question, should you then intervene with professional help? There are trauma-informed therapists all over the nation that specifically work with all ages who have experienced trauma that can allow that person to truly process the traumatic events in a safe and supportive environment.
I'm a parent myself, Christina, and I struggle with this idea of talking with my daughter about some sensitive topics because I don't want to put something in her head. How do you kind of walk this fine line as a parent or as a coworker or as a friend?
Heather, I'm so happy you brought that up because there is a misconception that talking about suicide somehow plants the idea. And research has debunked that. What we know is that the number one thing you should do and can do is talk about suicidal feelings and thoughts. Bring them to the table, have these conversations, and ask, hey, I know this is hard for us to talk about, but have you ever had these thoughts? What do the feelings look like for you? And really start and model a conversation for your child so that he or she can come back to you at any point and revisit as needed.
Sadly, it's not just affecting school-aged children. We're also learning today that a father of someone killed in the Newtown school shooting took his life. That was several years ago. And here we have today a father ending his life.
Yes. I think this shines a light of the debilitating impacts of trauma, that even if you yourself are not the direct survivor, if it is somebody that you love, that is close to you, family or friend, that can impact your overall mental health and the trajectory of your life. And so all people should be aware of what survivor's guilt looks like and that there are resources in our community for those to access it.
It really is such a heartbreaking thing. Thank you so much for coming on and talking with us and giving us that advice. Thank you so much. If you or someone you love needs to talk, here is the National Suicide Lifeline, that number right there on your screen, 1-800-273-TALK. Again, that's 1-800-273-8255.